Hi, Johannes Keating here. This will be a much briefer follow-up to the earlier video that I did on couples therapy. It was 90 minutes. It was a beast. But a lot of you, thankfully, expressed appreciation and enthusiasm and interest. It was 90 minutes because not only did I do the application section, where I looked at four of the probably the most difficult couples that I ever worked with. I wanted to showcase that. But I also did a whole lot on the nuts and bolts of the frame, the therapeutic frame. There was my guesstimated track record as a couples therapist, and there was the foundational assumptions and my aims. So that's now in my rear view mirror. Thank God. I don't want to do that again. But yeah, a much briefer follow up. This will be pure application, and please enjoy. Couples therapy vignettes, drive by, drop in Tapas style. So this will be devoid of the entire context. We'll look at a course of treatment. We'll drive by to a given juncture, drop in, you'll get a little tapas, and hopefully get a sense for a way of working here. So the case that I will discuss today will demonstrate a way to handle the clinical challenges where one partner engages in explosive discharge, a tendency to blow up at his son and his husband, where one partner defends his defenses and justifies treating the others poorly, where the couple are approaching their child in different ways. So we're going to get into parenting difficulties, and the one partner tends to verbally abuse the son, where one partner reverses his position and violates the therapeutic agreement. I will illustrate how to address the defense of damage control in trying to manage and diffuse the explosive partner. I will illustrate how to address the apparent lack of remorse for hurtful behavior, and you will hear me highlight for the couple what repair could look and sound like. I will illustrate how I address a situation where one partner blames his brain chemistry for his behavior. I will illustrate how to address the underlying elephant in the living room that the couple's conflicts and acrimony appear to be designed to cover up. The review of the previous presentation I already went over, but if you didn't see that and you're interested, I will include a link to that in the description section of this video. So in this little case study that I will showcase, I hope to continue to impart a flavor for how I work with couples, but more specifically, I hope to convey the importance of addressing each partner's defenses or their main defensive contribution to the distancing between them. I want to further illustrate the intervention of painting a contrasting picture, which looks like a mere behavioral suggestion, but actually it also has the function of driving home critical insight around the distinction between feelings and how feelings are handled. And it also helps with developing positive goals. I hope that you will see how I work aims to flesh out the core underlying conflicts and the importance of bringing those conflicts out into the open. I hope to convey how much more there is to this way of working other than just pressing for feelings, and that so much of good couples therapy is about identifying the central interpersonal dynamics and patterns and then addressing those skillfully. I also hope to convey that I don't shy away from taking positions. It was Anthony Ashley Cooper who said, "The heart is never neutral." So from my point of view, to work with heart means, in part, to thoughtfully, discriminately be honest about our opinions and not collude with maladaptive ways of relating, while always respecting and trying to safeguard the client's autonomy. So this is not about just blurting out opinions or self-inserting for its own sake. No, no, no. You are to be very thoughtful about it. But to work with heart means that there will be moments when we don't hide our heart. So an example of me taking a position in this case is that I make it clear that I see screaming at a child as abusive behavior. So the case study is really a conglomerate of different cases. This ensures complete anonymity. I will drop you in midstream on a particular dynamic and then highlight my intervention, some of the formulation. And so, yeah, here, so let's have a look at the couple. So enter Jonathan and Bradley. This is a gay couple raising a son. And in light of what I just said, I hope you understand that this is ultimately a fictional couple, even though it's, of course, quite inspired by real material. So we drop in at a point where it's been fleshed out that Jonathan engages in explosive discharge through yelling. Bradley does not like this, does not think it's good for their son. I happen to agree. Jonathan, on the other hand, he defends his behavior. Therapist to Bradley. So what you want to accomplish isn't going to be accomplished. He doesn't aspire to change this. He doesn't have the same vision. He wants to be able to have this explosive discharge and have that be okay. Have I understood your position, Jonathan? Bracketing. Clarification of what is so. Highlighting the consequences, which amounts to an adaptation of a tier 1 mini head-on collision, actually. Allowing Bradley to make an informed choice about what he wants to do, given the given of Jonathan's position. Note the temptation to want to see and treat Jonathan as if he's more conflicted, by the way, when he's actually not at this juncture. Jonathan, well, if they would just provoke me less, I would not yell. Therapist, being provoked is part of any relationship. We all do things that make others angry. So I have no problem with you being angry. I was only focusing on how you deal with your anger, which on the surface, at least, doesn't look optimal for anybody, including you. Bracket. So clarifying the vital distinction between a feeling and how it's handled, and being honest that yelling does not seem optimal from my vantage point. On the surface, at least, is to try to undo unconscious defiance and to acknowledge that I understand that my opinion, well, is just that. It's my opinion, and it might be incorrect and not shared. Jonathan, well, like I said, they should not provoke me then. Therapist, so your position is that if you feel provoked, you are okay with yelling at Bradley and your son. More clarification, shoring up a clear understanding of the position. Jonathan, yup. Therapist, so were you thinking that it's possible to have a relationship but never be provoked? Have you found such a relationship? Bracket, soft challenge, casting doubt on what appears to be Jonathan's premise. Jonathan, I don't know if it's possible, but you're getting my raw reactions. Therapist, and so does your son, apparently. Do you see that as being in your son's best interests, that you handle your anger by explosive discharge of anxiety? Do you think that's helpful to him? Casting doubt on what is clearly maladaptive and destructive. Jonathan, well, not really, but I can't help it. When I'm being judged and controlled, this is what happens. The question of Bradley judging and trying to control Jonathan is explored. It turns out that Bradley tries to diffuse the situation when Jonathan loses his temper. Therapist to Jonathan. As far as I can tell, you are being judged and controlled. If by judged you mean Bradley doesn't like how you behave, then yes. And he tries to diffuse it, which is an attempt at control. So how would you like for Bradley to deal with it when you yell at your son? Is there something that he could do that would work better for you? He may not be willing to do it, but we should at least know what it is to consider it. Acknowledging what appears to be so, seeking clarity on Jonathan's views on how he would rather have Bradley respond. The spirit here is one of information gathering. Jonathan, well, I want him to take my side. Therapist, could we look at an example of him not taking your side? Jonathan talks about an instance where he was yelling at his son. Bradley confirms that he too recalls the incident in the same way. Therapist to Jonathan, so you want him to say that it's okay to verbally abuse and lay into your son. You want him to tell you that that's okay? Is it okay with you? If someone else was treating your son like that, would you be okay with it? Bracketing, casting doubt on Jonathan's premise and his behavior by not sugarcoating the reality of the verbal abuse, having the spine, frankly, to call things for what they are. It conveys to the couple that the therapist has the capacity to get to the bottom of things, to really face things, to the capacity to handle their most destructive behaviors. And any negative reactions that Jonathan might have about this unflinching attitude, well, it can be dealt with. It's not, it wouldn't, the idea that he could react untowardly or negatively is not a reason not to call a spade a spade. Jonathan, no, therapist. And it's not okay for Bradley either. It's reasonable for him to feel that way. That you're angry is fine, but how you're dealing with it, he doesn't like it, nor would many others. Bracket. Declaring that Bradley not liking it when Jonathan yells at their son is reasonable, and introducing the all-important idea that a feeling is one thing and how the feeling is handled is quite another. Had I been wishy-washy or neutral here and not taken a strong, clear stand on this issue, I would be giving the couple reason to question my moral compass and my ability to call things for what they are. Jonathan, okay. Therapist. So given that Bradley doesn't like how you deal with your anger, and how would you like for him to handle that? What would work better for you rather than him trying to diffuse it? He can't support your behavior. Jonathan, well, I don't want him to think less of me. Therapist to Bradley, well, do you think less of him? Bradley, as a parent, yeah. Therapist to Bradley, so you're angry with him for the way he treats your son, is that right? Bradley, oh, very much so. Therapist, can we look at how you deal with your anger? Do you treat him as if he has no redeeming qualities as a parent? Defense identification. Bradley, yeah, there might be some truth to that. Therapist, you think that's the best way to deal with your anger? Is that the example that you want to set for your son? Bracketing. So casting doubt on Bradley's defense of demonizing Jonathan, leveraging his healthy interest in setting a good example for their son. This also communicates to Jonathan that I'm not picking on him specifically, but I'm applying the same standards to both equally. The standard being, is this what is best for your son? That is, after all, the fundamental parental prime directive. Bradley, no, but I don't know what else to do. Therapist, do you think that it might be easier for you, Bradley, to instead of trying to diffuse, just say to Jonathan, I'm really angry at you for how you treated our son today. That's my son and it makes me mad. I understand that you're angry at him. I'm angry at him too. But when you deal with your anger that way, it really makes me mad. You think that might make your life easier? Bracket. Proposing a positive goal and vision to shoot for, clarifying that there are alternatives to his habitual behaviors. Bradley, I do. I've never talked in such a direct way before, but when you put it like that, I think that it could actually be more satisfying. Therapist to Jonathan, how would that be for you if Bradley was just direct? Jonathan, well, I'd prefer it, because when you try to diffuse it, Bradley, you're trying to manage me, and I resent that. So, bracket, a new action template has been suggested, and both respond that this would be preferable, which begins to cement a conscious therapeutic alliance around Bradley giving up management mode in favor of emotional intimacy. But check it out. The beginning of this conscious alliance is around Bradley giving up the old for the new, wanting to do that, wanting to work towards that. But it's not yet about Jonathan giving up the old for the new. That we don't have at this stage. The focus shifts to how they are not parenting together, but instead each approaching their son differently. Therapist to both. So why is it that each of you are dealing with your son alone? He needs you to be together, to speak with one voice. So if there's a problem, the two of you should talk it out ahead of time, and then together go to him with a unified front, speaking with one voice. I think your job would be easier if you did that. What do you think? Here, addressing the obvious parenting issue that they're not on the same page with parenting, and then being transparent about my bias that I think they should try to get on the same page for the sake of the child and for their own sake. Both of them, well, yeah, you have a point there. Therapist, what would happen if you try to talk something out to come up with a parenting plan together? I think that's what your son is asking for. The couple agree with this. Therapist, whatever gets in the way of the two of you having that conversation seems to be part of what we're up against. The couple agree and agree to try to discuss what they each think would be best for their son. Now we drop in at a different juncture in the treatment. The couple were hesitant to continue working with me. And exploring this, what emerged was that what gave Jonathan pause was the fact that I had facilitated Bradley to be more open and honest with his anger towards him. And even though Jonathan had said that he preferred that earlier in the treatment, now he's realizing he doesn't like it. Therapist, I'm certainly willing to acknowledge that I may have made mistakes. I have never facilitated a flawless course of couples therapy or any therapy. But you mean from your point of view, that would wipe out what good that we have done together? Jonathan, yeah, it feels that way. Therapist, so what appears to be the normal ups and downs of couples counseling are somehow different for you, somehow of a different magnitude. Something of a different magnitude must have happened for you. Can we try to understand that together? Jonathan, well, because of you, Bradley's now expressing anger towards me, and it's very distressing, actually, even though I thought I preferred it to when he was trying to manage me. Therapist, Jonathan, so when Bradley is mad at you, and based on what I have seen and hear, conveying it frankly but without being mean about it, you tell me if I'm wrong, though, it takes on a different order of magnitude than him just being mad at you. It seems to be more than that to you. Jonathan, yeah, like I'm being persecuted. Bracket, Jonathan appears to have a lower ego-adaptive capacity, as evidenced by his tendency to lose impulse control and have explosive discharge, and his tendency to appear to use regressive defenses, splitting, projection, acting out behaviors. Therapist, so for you, it takes on a catastrophic proportion, like he's judging your whole personhood, and that you have no redeeming qualities as a human being. That's how you experience it? Bracket, clarifying Jonathan's experience, his perspective, and then setting the stage for defense identification. Jonathan, yeah, that's right. Therapist, when you're centered and grounded, do you really think that's how he feels about you? Or do you think that he's just angry about that item? Bracket, here I'm assessing reality testing capacities, the degree of deterioration. Jonathan, I just don't want to hear about it. Therapist, well, no one wants to hear about it, but it seems to be more than that. It seems to be devastating to you, that what you hear is that you have no redeeming qualities as a human being. I'm just a complete loser. That's what you hear. So I can see why you would want to avoid it if that's the reaction inside of you, within you, even if that's not his intention, but how you filter it. Therapist to Jonathan, has anyone ever treated you that way? Jonathan is able to see how his father treated him very poorly, and that he is actually superimposing the template of his father onto Bradley. The focus shifts to Bradley's feelings and his tendency to deal with his anger by trying to manage the relationship, which, by the way, his tendency to try to manage the relationship, it didn't just evaporate because earlier he had agreed it would be better to give that behavior up in favor of emotional intimacy. Defensive behaviors, they will keep coming up, they will crop up until they're more finally restructured. But that takes a while. That doesn't happen overnight. Therapist to Bradley, you may have to accept his reactions rather than spending the rest of your life trying to manage his anxiety, being his Valium, if you will. Allow him to be responsible for that himself. You don't have to manage him anymore, but instead just assume that this is how he's going to be sometimes. Bracket. Bradley seems to feel that it's his job to manage Jonathan's behaviors rather than Jonathan trying to get to the bottom of it. Bradley, yeah, I agree. Managing him is draining and not even that effective. I find myself slipping back into managing mode, But I see how instead I can connect to the fact that I'm angry and just say that. Based on Bradley's responses, he appears to have a greater ego-adaptive capacity than Jonathan does. Another juncture, we're looking at Jonathan's tendency to lose his temper. Therapist to Jonathan. I appreciate that this is the best you can do sometimes, and that you aspire to do better. And I'll just take that as a given, that you have very little conscious control over some of these reactions once you've reached your threshold. Bracket. It's important to acknowledge that at a certain threshold, Jonathan truly does lose impulse control. If this is not acknowledged, Jonathan will feel blamed for something he truly does not have control over at a certain juncture. Jonathan. Yeah, that's right. Once I reach my threshold, it's all over. Therapist. That's a very intimate thing for you to share. This is what I mean by intimacy when you say things like that. Bracket. Helping Jonathan see that he's being emotionally intimate is an important corrective and contributes to greater buy-in on the therapeutic task. It's also important because it conveys that I'm approaching Jonathan and the couple as a whole as not just resistant individuals, but also individuals with strengths, individuals that sometimes become emotionally intimate. So it's important in terms of me not approaching anybody as if they're one-dimensional, say only resistant, when no one is only resistant. Jonathan, thank you. That's encouraging to hear. And I do want to be different. Therapist, so you aspire to be different. How come? What about being different appeals to you? Jonathan, I don't want to be in so much emotional pain. When I reach my threshold, it's horrible. It's horrible for me, for everyone. So nobody likes being around you when you've reached your threshold. You don't like it. They don't like it. No one likes it. It's probably more painful for you than it is for them when you're in that state of mind. So you're both on the same page. I don't understand where the disagreement is. Bradley? Well, it seems that we're in agreement, actually. The issue of Jonathan never apologizing for blowing up comes up. Jonathan perseverates how terrible it is for him to enter these painful states of mind. Therapist. So it's terrible for you, Jonathan, when this happens and you reach your threshold, and it's no fun for them either. So does a part of you feel bad, as in remorseful, that this is the best you can do once you settle down? Jonathan. It's best I remove myself when I reach my threshold. Therapist to Jonathan. It's best for you to remove yourself and calm down. Sticking around isn't going to help, so removing yourself, absolutely. But when you remove yourself to calm down, when you do come back, do you ever let them know that it wasn't their fault how you reacted? Obviously, they provoke feelings in you, but how you deal with your feelings, do you ever let them know that it isn't their fault? And that though it's probably more painful for you than it is for them, that you can understand that it's no fun for them when you respond that way and become explosive or having to remove yourself. Jonathan, no, not necessarily. Bradley, definitely not. Therapist to Jonathan, do you ever say, I don't even like being around myself when I'm like that. I can understand if you don't either. Both of them, no. Therapist, it might help all of you if you acknowledge, Jonathan, that you had to leave to take care of yourself and calm down, but the fact that you have that threshold and that you have a tendency to deal with your feelings the way you do when you reach your threshold, that isn't their fault. Bradley, God, that would be amazing. Jonathan, I'm open to learning more about this new way of communicating. I think it could help me too, actually. Therapist to Jonathan. So Jonathan, you can say, I can't help it, but I want you to know that it wasn't your fault. This is how I have been for a long time. That you provoke feelings in me, that's on you guys, but this reaction where I have to leave the room to avoid exploding, it's not your fault. And I don't like it when I am that way, and I don't blame you if you don't like it either. It's miserable for all of us. Bracket. This teaches new important relational skills while further driving home the vital distinction between feelings, anxiety, and defense, and it boosts and clarifies the positive goals. Drive by, drop in, where Jonathan is now trying to articulate his sense of loss of control. Therapist. It is the best you can do. You really do lose impulse control sometimes, and it's clear your mind goes into a hurricane. And I hope that you, Bradley, I hope that you can see that Jonathan has no conscious control over this, which is why it'll be so important for you, Jonathan, to spot the red flags and remove yourself from the others until you have calmed down. Now, drive by, drop in at another juncture where Jonathan appears to be jerking me and Bradley around, not following through on our agreement to work on emotional intimacy, instead taking the position that he has a right to vent his anger by saying hurtful things if he wants to. Therapist, you have just pulled the rug out and blown off our common agreement. You say you have the right to say hurtful things, but that is antithetical to what we've been working towards and agreed to. Jonathan, I'm angry. This is explored a bit. He's angry because he feels conditions on him. He wants to feel unconditionally accepted, and because Bradley rejects some of his overtures for attention throughout the week. Therapist, if that's what you want and you're not getting that, then I can see why you'd be angry. But one thing is that you're angry. The other is how you're dealing with your anger right now. Jonathan, well, help me think this through. Therapist, yeah, let's have a think. You're angry that Bradley does not unconditionally accept you the way you are, and for not appreciating the memes that you send him. But then you deal with that by going back on our agreement and taking a defiant position that you have the right to say hurtful things. Jonathan, let's see. Every time you say that you're going to do something, but then don't do it, it's damaging to the relationship. When you say you're going to do something, people that you have a relationship with, they have to be able to count on that, just like you have the right to count on them for the same thing. If that they say that they're going to do something. Every time that doesn't happen, it's damaging to the relationship. And that damage, that hurt, is in addition to you saying the hurtful things that you say. Jonathan, well, I don't know if I want to work on emotional intimacy anymore. I'm having a bad day. Therapist, well, you can work on or not work on whatever you want, but you are going back on what you said before. You're not being consistent. You said before that working on being emotionally intimate was important to you and that you wanted to work on it. And now you're angry. And now that you're angry, you just pulled the rug out and totally reversed your position. So how is it for you that Bradley can't count on you to do what you say you're going to do? That you can have a bad day and take it all back? Bradley? What sucks for me, let me tell you. Jonathan? It's just probably my brain chemistry. Therapist to Jonathan. So the main thing going on is that you have totally reversed your position. In our last session, you reiterated that you wanted to work on being emotionally intimate and that you could see your role in things, and you saw how your depression is situational and not endogenous, as it fluctuates concomitantly with how you see yourself being treated by Bradley and your son. We saw how, therefore, a big component of your depression is about how you handle feelings. Jonathan, okay, but now I think I'm a victim of my brain chemistry, and I could care less about our last session. Therapist to Jonathan. So you're not consistent. What changed? Here we were working, we had an agreement, and you assured me that this is something that was important for you to work on, and now you could care less. It's not important to you. You're back to saying it's chemical and that you're a victim of your brain chemistry. So you're all over the map. Jonathan. So, therapist to Jonathan. Well, so I can't reasonably have confidence in anything you say because it keeps changing. Is this just with me that things keep changing, or is this how you are with others too? Jonathan. I do it a lot with everyone. I need to snap out of this. I'm sorry, guys. I'm sorry. Okay, bracket. So not shying away from directly and unflinchingly describing Jonathan's resistance and its cost, right? Because it's so clearly jeopardizing the therapeutic alliance and the entire treatment. while accepting his right to pull the plug on the agreement. That eventually gets through to him. An approach of coddling him would have gratified regressive wishes and the underlying need for self-sabotage. Now, we drive by and drop in towards the end of the treatment, where the couple are no longer fighting. Jonathan is no longer engaging in explosive discharge, and there's a relative absence of conflict, which is actually unsettling for both of them. Therapist. I think both of you are fearful of emotional intimacy and closeness. And now that there's a relative absence of conflict, which is a good thing, that took a lot of work and courage on both of your parts. Now we can get the marriage to the next level where you're emotionally intimate. The couple look anxious, look at each other, look at me. There's a longer pause. Therapist. Maybe you're both fearful of emotional closeness. And some of the conflict and acrimony may have been a cover. So now that we've dealt with that, what is it that you dread about being together and alone? It could be different for each of you, but what are you dreading? Bradley. We don't have much in common. Jonathan nods. Therapist. So you dread facing that you don't have a lot in common. Is that the elephant in the living room that we're not talking about? The couple nod. Therapist. Maybe you don't enjoy aspects of being with the other. Are there things you can't talk about because the other isn't interested? The couple agree and discuss how they are each interested in things, but the other is not interested in those things. And that it's hard to face that fact. So the couple, they learned how to talk about this issue, which was helpful to them. But it did not resolve the underlying fundamental difference in interests and outlook on the world, which remained, but which did not reflect neurotic conflict or neurotic suffering. It was fundamental. It was reality-based. Treatment was terminated a session or two after this. So the neurotic layer of their suffering was greatly diminished. Now they just face the normal reality-based suffering of being in a difficult situation where they don't have much in common. I often say that psychotherapy can help address the layer of pain and suffering that is neurotic, that is self-inflicted. Whatever role a given individual has in their own suffering, that's what psychotherapy can resolve or at least ameliorate. But the slings and arrows of the world, the layer of suffering that is just from being human in the world that we are in, therapy cannot help you resolve. That is life. So in closing, I hope that it came across that I'm not devoid of empathy, that there is empathy, but there is no coddling, an important distinction. No avoiding the main thing going on in the room by distracting the couple with superficial date night suggestions and such things. I don't mean to trash that entirely. Of course, sometimes that can be helpful to suggest date nights and such. But to be open and honest, I am skeptical of courses of treatment where that seems to be the bulk of the focus, like just suggesting things like date night. Being laser focused on each partner's contributions to the presenting problems, their resistances, while not missing opportunities to highlight strengths and moments when they are being emotionally intimate. There is a big focus on clarifying healthier alternatives. Not only does that tend to sort out and distinguish the corners on the triangle of conflict, it's a way of portraiting intimacy. It's a way of clarifying positive goals and what we could all be shooting for, assuming that it appeals to both people comprising the couple. Not shying away from pointing out the logical consequences of their defenses. So this is really a version of the head-on collision. Yeah. Once the people comprising the couple can see their defensive ways of relating and the consequences of that, are they okay with that or not? Do they want to relinquish those behaviors or not? In the final analysis, it's that simple. Now, the couple turned the corners that they did without anyone having an unlocking of the unconscious. How about that? All right. That will be all for today. Thank you for watching. Happy holidays. Until next time.